welcome to Herd at Health. I'm with Drouin, CEO of Clarify Health, which is one of the leading healthcare analytics companies. Jean, we are kind of I shouldn't say post, but we're recovering from the pandemic. I'm wondering how the data analytics needs of your customers like payers, providers, and some life sciences companies have changed as a result of that.
Yeah, a couple of things I would say, and it has less to do with the pandemic. One is, as a society, we have moved to equity and social determinants being way more important. So that's a very important factor. The other is, in the last 3 years, with the rise of Datavant, HealthVerity, and others, the availability of massive data sets has become a reality, and so now there's new possibilities to answer the critical questions people have.
Right. Now, providers are under tremendous strain financially. How do you convince them that investing in data analytics is a worthwhile investment?
Great question. The challenge providers struggle with is not, hey, are data and analytics helpful in and of themselves? It's, once you have an insight from the data, how do you cause that insight to lead to a better action? And so sometimes they get a little bit stuck with what is the ROI from investing in all of this data, because a lot of the folks offering up ML, AI, etc., have a hard time demonstrating the ROI in the workflow.
Right.
And so to some degree, it's hard to fault the providers and the payers to some degree for demanding that ROI before they make that investment.
Now, data analytics is the backbone of value-based care, which is where everyone is trying to get to, but can you truly get there without value-based payments? So my question to you is, are you seeing more companies, be it providers or life science companies, enter into these value-based contracts where they are at risk, essentially?
So I believe that the reason value-based care has not scaled the way we'd have liked it is we're paying doctors in the wrong way.
Okay.
And that we have to maintain fee-for-service and instead make fee-for-service smarter. The issue that we've had is almost all value-based models are what's called retrospective look-back.
Right.
So effectively you say to a doctor, hey, trust me, in 12 to 18 months, you may or may not get some pool of money, and I'm not going to be able to tell you exactly why. Imagine a world though, where instead you said, hey, orthopedic surgeon, based on the choices you've made in the last month, here's exactly why you've been paid the way you are. I think what you would find is applying the learnings of behavioral economics and micro incentives and paying in that way would make it far easier to scale, fee-for-service that has value.
That's a radical thought. Thank you so much for spending the time with us at MedCity News today.
Likewise, thank you.